It's JT, and we're at Crossbridge Behavioral Health, a division of Baptist Health. We've already told you that Baptist Health is one of the top 15 health systems in the entire country, right here in Montgomery, Alabama. Psychologists say that 1 in 4 people will deal with a behavioral health or mental health issue in their lifetime. That's why the staff at Crossbridge is here. We had a chance to speak with the director about exactly what they do here at Crossbridge.
At Crossbridge, we're an adult and geriatric mental health, behavioral health facility. We're part of Baptist South, and we're very proud of our ministry here and our work with patients and their families. And we have a capacity of about 60 patients.
Leanne was able to speak with Michelle about identifying some of the symptoms and ways you can help people in your family that may be dealing with behavioral health or mental health issues.
Thanks, JT. Michelle, you know, mental health has been in the news a lot lately, from Aurora to Newtown, and even affected us here in Alabama, in South Alabama, where that gentleman took the little boy and was in that underground cave. I mean, just so scary.
Yes, it
and,
is.
you know, there are a lot of people who need help, but family members, I would imagine, see it first, and it would be very hard to approach the person who needed the behavioral help or needed to be seen by a doctor, somebody who can really treat them. How do families and how do you just approach people about it?
Well, it's very difficult because it is the patient that's usually the last one to recognize that something's going on, or they don't want to accept it. You know, they're in denial. I think it's very important to talk with your family member and let them know you're seeing some differences and some changes, and also to seek help for them. You know, talk to your primary care physician, you know, or your local mental health, or you know, other family members to help you kind of talk to that person and help them recognize that something's going on and that it probably can be treated.
And so your primary care doctor would be the first step, and then if you did need further assistance or further treatment, what's the next step? What would the doctor, your primary care doctor, do?
Well, he might refer you to an outpatient center. There are outpatient mental health centers. There are partial hospitalization programs where you can go during the day. We have one of those and have groups. And then the hospital where you would receive treatment for your acute mental illnesses. But it's normally a short-term stay.
Specifically here at Crossbridge, what are some of the different treatment options? Because I would imagine that there's a full array of mental illnesses, from just emotional, being depressed, or all the way up to psychosis and schizophrenia. What are the different treatment options?
Well, we have a variety of different professionals here. We have recreational therapists, we have licensed counselors, and we have social workers, we have mental health nurses, and we have techs that all play a part, as well as our psychiatrist, in treating the individuals. We provide group therapy, we provide family counseling. We try really hard to get the families involved in the treatment because it's very important that the patient have as much support as they can.
When it comes to recreation and life at Crossbridge, we talk with the recreational director about some of the different activities and therapies they use at Crossbridge.
A bunch of different arts and crafts that we do, and on special days we have a group called Dogs on Call that comes from Easter Seals, and they're trained through the Easter Seals as therapy dogs, and patients really look forward to that.
Once again, a reminder, if there are immediate concerns in your family when it comes to behavioral health or mental health, you should always visit your local emergency room. But there's always treatment options at Crossbridge, a division of Baptist Health. For more information, visit baptistfirst.org.